My name is Stephen Osei-Bonsu. I'm the director for DIB at Open Sky, and also I do some work at Open Sky as a mental health clinician.
Hello, everyone. Oh, is that too loud? Hopefully not. My name is Shakeerah Mcleod. I am a case manager, human service coordinator at the Westboro site office, and I am also a licensed alcohol and drug counselor, and I do engage in individual counseling in the community on a part-time basis.
So today we're going to talk about navigating the maze, how Black individuals, Black folks, the Black community, how to navigate this maze to get help for our mental health, resources, support system that we have, maybe in the Central Mass, by extension, throughout the whole country.
I'm going to just explain a little bit more to piggyback off what Stephen just said with regards to navigating the maze. So when we think about the maze as a whole, right, before we even jump into our topic of discussion, there's a point of entry, and there are usually many paths that one can take, and the ultimate goal is to get to the end. When you think of navigating the maze as a marginalized community, specifically we'll be focusing on, with a more focused lens, the Black community. They're automatically navigating a path that's unwelcoming for the most part, both historically and even in modern day. So some things to be mindful of is maneuvering through that maze is going to be complex, often unwelcoming and shaped by things like historical trauma, systematic barriers that have been put up, and then ultimately the journey for this community as a Black individual is to find healing, right? And you have to be diligent, you have to have tenacity, you have to be patient, and you have to ultimately see your way through to the other side. Think of the entry point as one recognizing the need for help. Think of the walls of the maze as the structural barriers that the individual person has to kind of work against. And ultimately, that's navigating the maze, just to provide some more context.
As you can understand, we all have our challenges. We might have mental health, but for the Black community, we have a unique challenge. We all have the same weight, but with the discrimination, with racism, with microaggression, with all these barriers, all these systemic issues, it makes folks in the Black community who have challenges even worse. Even we have to navigate these systems. When you're a Black person, when you're not being trusted, have to go through these insurance issues, it makes it hard for the Black community. So I want to use this data to talk about how some of us have used resilience, have been creative and innovative in navigating this maze to get to where we need to be. And we hope that at the end of today, we all might identify actions that we can take as a community, that you can take as a provider, that you can take as somebody who is receiving services in this system, how we can make it work and make it better than we came to meet it or than what we've been experiencing.
So we're going to jump into the presentation, and so initially we're going to look at why this topic. Oh, sorry, Stephen, if you go back, thank you, appreciate it. I gave Stephen clicking duties, you guys, that was too much for me, so thanks. So with the first point, historical and contemporary challenges in accessing mental health. So what do we mean by this? And this is one of the objectives of the presentation today. This usually just refers to like ongoing obstacles that marginalized communities experience, specifically when seeking to have adequate mental health support. These challenges are undeniably linked to historical inequalities and modern day challenges, specifically systems that exist today. The intersection of race, trauma, and systematic barriers. This more or less just refers to the complex ways in which racial identity, experience of trauma, and structural inequalities that exist in our society basically intersect to shape how we live our lives, our overall wellness and well-being. This primarily affects, for reference, marginalized communities, so Black, Indigenous, people of color, the BIPOC community.
One thing that we're also seeing is that with our population, there are a lot of issues that we have to deal with. Currently, you have about 18.8% of the Black individuals in the US who live in poverty. And that is a big number of people who might not have resources to deal with their mental health challenges. We know that the Black population, currently we have about 4.6% of the Black population who are immigrants. And so if such a population receives enough help, enough support, it goes a long way to affect their families in other communities as well.
So we're going to jump into just some quick statistical data, and the objective of showing the next few slides, I think there are about 2 or 3, is just for the audience to hold some context. So this information was compiled from recent data from the US Census Bureau, and also, so 2020 data, the US Census usually updates their data about every 10 years. And then 2023 data from the Pew Research Center. And so I'm gonna just start to just provide a little bit more context, but hold the statistics as we move forward in our presentation. It will provide more information with regards to why, okay? So Black Americans make up about 13.7% of the US population, or nearly about 48.3 million people currently in the US. 16.4%, or about 7,661,000 Black adults reported having some form of mental illness. To provide some more context there with reported data that included mental health conditions such as anxiety, depression, and mood disorders.
And then we can see that, like I said earlier, these are conditions which sometimes have a big predominance in the Black community. For example, with the 18.8% of our population, which more than 8 million to about 9 million. And these are folks, brothers, fathers, sisters, who are in the community, and all these impacts goes a long way to impact their families, the work they do. And so with the Black community, you see that we have all these challenges on top of other challenges, which makes it worse. And sometimes what happens is you work with a colleague, you are a friend with somebody in the Black community, and they have a certain kind of stress, pressure, weight on them that you might not know, that you might not understand. Are we different from other communities? No, we are not. But the circumstances, the situations, the systemic issues makes the challenges in navigating the maze in the Black community harder.
Okay, the next few stats available. 15.6%, or about 7,332,000 Black adults reported experiencing both mental illness and a substance use disorder. Now this is really important to hold because it speaks to individuals experiencing co-occurring disorders or dual diagnosis, right? So we want to capture data that holds that. Again, that can get overlooked primarily in terms of Black individuals seeking supportive care and health care, primarily mental health services. I think I do the next one, I see that?
Yeah, and then so what we know is that we had about 4 million Black individuals who do not have health insurance. And this is also as a result of all the other systems, the poverty, the systemic issues that affect even getting a health insurance. And so you can see that if you have 4 million people who do not have health insurance, which can be a ticket to getting the right services, there is no wonder you're going to have most of us having depression, anxiety, and all the other diagnoses. And what happens? Because I don't have access to care, I may find another way to deal with my pain, find other ways to make sure I feel better. And sometimes people resort to substance use. Not because they want to do it, but that's what they think they need in those moments to feel better. And what happens? This even compounds the problem.
So we're going to go to the next slide. About 40% of Black youth with mental health issues did not receive the treatment they needed. This is a gap in care that extends to other racial groups. In fact, pause here just to be mindful. We have a focus lens today on the Black community, but it's important to realize that primarily marginalized groups experience disparities in care overall, but particularly the statistic that I just referenced is more pronounced in Black youth. 60% or 10 million, for reference, of Black young adults, we primarily focused on the age 18 to 25 with mental health issues did not receive the necessary treatment. Again, we'll provide more context as we move forward in the presentation, but again, hold that statistic.
And the data also shows that we have 55%, which is about 20 million of Black adults who are aged between 25 and 49. And this is one of the reasons why we see a big part of our population who are able-bodied men and women are not able to do what they need to do to make themselves better. They don't have access to treatment. And this is a big number. 25 to 49 years, we have 20 million of these people in our community not able to get access to care, to treatment. That is not good. That is not great.
So we're going to kind of jump into the heart of our presentation, and we're looking primarily at what the maze looks like today. And the maze compiles historical factors initially, and sometimes individuals might say, well, why aren't we primarily looking at modern day issues, which we will. It's important to set a foundation. And so on the board, you'll see a list of historical factors. I'm just going to provide a little bit more context to explain why they exist, okay? So when we think about slavery, Jim Crow era, segregation, and the civil rights struggle, we're compiling them because they are all historical events, right, that shaped the Black community as a whole today, but I do want to individually provide some more context for each. So when we think even in terms of slavery, individuals who were enslaved, they were denied autonomy initially, right? They were viewed as property and dehumanized. They were subjected to inhumane treatment. This led to intergenerational trauma that has extended across generations within the Black community. An example of that would be if you model behavior, the family unit, what you've experienced in terms of processing trauma, your emotional response, you might pass that down. There were family separations of systematic dehumanization, which contributed to long-term distrust, that word will come back, of institutions, including mental health care systems. When we think in terms of segregation, specifically in Jim Crow in healthcare, Black patients were excluded from hospitals, right? And mental health institutions, forcing them to rely heavily on what they could, which was usually underfunded, underserved, segregated facilities. And or home remedies, right? Concoctions that were developed in the midst of trying to figure out how to provide adequate care. Negro insane asylums, right, where Black individuals who were suffering from clear mental health related issues were placed in overcrowded, underrun, inhumane institutions where they faced abuse and mistreatment. There were medical experimentations throughout slavery. Two notable ones for reference that people might be familiar with. I'll start, his name was J. Marion Sims. In the mid-1840s, he was known as the doctor of gynecology. He used enslaved African-American women to run inhumane tests without anesthesia, right? And those advancements are still known today to the medical community as a whole, but it speaks to values with the foundation in terms of mistrust and how Black bodies were dehumanized. If we think in terms of the 20th century, there was forced sterilization and misdiagnosis. Reasonably, black women were disproportionately sterilized under the eugenics program. Particularly, that time period was about the mid-1960s, 70s. And when we think again about 1972, right, that time period is not long ago. For context, I was born in 1983, right? Psychiatric misdiagnosis was widespread. Black individuals with legitimate mental health concerns were often diagnosed with schizophrenia versus mood disorders, anxiety, depression, experience with traumatic events, right, were disregarded. There were barriers to access and care with legal segregation ended. Hospitals and mental health institutions still did not remain welcoming with black patients, and in the end, they usually received lower quality care. Unethical practices and broken promises. Well, one thing I do want to note in terms of discrimination in healthcare and research is, for research, and it still unfortunately remains a fact today, that black individuals are usually underserved or underrepresented in clinical trials. Unethical practices and broken promises. A really modern day example that we can see is the black community, specifically COVID, we'll use an example. A lot of individuals in black communities were very weary or fearful of getting vaccines. There were some initiatives that took place with local church leaders, for example, community organizers, to make sure those communities were informed and educated just because of that deep-rooted mistrust in healthcare. Another just thing that I want to leave people with is the Tuskegee experiment that took place around 1932 and lasted to 1972. That bears weight to this day with regards to mistrust in healthcare, where individual black men were not informed about the context of this study. They were not treated for their syphilis. 128 participants ended up dying as a result, and even when penicillin was readily available, it was not provided in terms of adequate care. When we look at collective trauma, just to provide some context before describing what that is, think about the events. War is a good example, genocide. The pandemic is a really great example of where communities as a whole experience collective trauma. It refers to trauma that happens primarily in large groups. Individuals can experience trauma as we know it, but we're looking more mainstream. And an example historically would be slavery. Currently could be something like black individuals having increased anxiety and depression by witnessing police brutality, for example, mass incarcerations, right? And so I just want people to be mindful that we'll pick back up on trauma and how that directly impacts the black community.
When we talk about navigating this maze, and talking about the black community, we have a culture, and that culture impacts how we navigate this maze. In this culture, there is stigma. People assume that when you have mental health issues, you might be unproductive, you are crazy, you cannot be a third partner, they can't reason with you. It's assumed, or people think, that when you have mental health challenges, and then you speak about that, you are not strong. We equate silence with resilience and strength. So when you are open talking about your mental health issues, they feel like, no, you cannot deal with it. You are not strong enough to deal with your own issues. And so there are many people in the community who are navigating this maze in silence. Less because some of the things, they are less. In our community, something that we have seen is that there are cultural expectations. And some of this is, you don't have to talk about your mental health issue because it is a private issue. I don't have to know about it. Carry your own cross. Don't tell anyone. And so there are folks in families who could have benefited from a support system within the family, but are unable to speak about it because it's kind of forbidden to talk about your mental health challenges. In our community, spirituality and faith are a cornerstone. We believe in prayer, we go to church, or we go to whatever religion we practice. And for some of these, it could be an issue. We have people who have mental health challenges, and they were told, pray all night. And so they don't sleep. Sleep deprivation makes their situation worse. There are those who rely on prayer and fasting more than seeking professional help. They think maybe if I seek professional help, it diminishes my faith, that I am somebody who is faithless. And so this contributes to the lack of unwillingness to seek for help in these situations. And faith leaders have a part to play. Sometimes, instead of talking about holistic healing, some decide to go on that narrow path of, let me pray for you, believe in God. But the good thing is, God places professionals in our path, in our way, as a resource, so God can work with them to make us whole. But lack of these messages in our community make other people not get the attention, the support, medical treatment, medical management, the things that they need to do to make them healthy.
Okay, we're going to go to the next slide. This slide we're going to break down for you in more detail the socioeconomic factors that Black individuals experience that make navigating healthcare, specifically mental health, extremely challenging. So the first is poverty and economic insecurity. Be mindful that most people who experience poverty or economically insecure, most things are going to be challenging initially to navigate. For Black people who already experience higher than normal disproportionate rates, higher rates of poverty, their access to mental health services through multiple interconnected factors are strained. We primarily want to be thinking of two things here, so affordability and availability, right? The lack of insurance, health insurance, Stephen had noted on that earlier. I'll provide more context. So Black individuals are primarily, usually, uninsured or underinsured, which restricts access to mental health professionals. So think about that. If I don't have health insurance, how am I going to access a service intervention that usually requires out-of-pocket funds? Medicaid, for example, is available, right? But other public assistance programs often have limited mental health coverage that can show up in ways of long waits in terms of accessing services when you need them immediately. I mentioned high copays, but think of out-of-pocket costs, right? The average out-of-pocket cost for insurance providers for mental health counseling, for example, at minimum can be $100 an hour. Even with insurance, it can be expensive and discouraging to individuals to seek treatment. Cost of therapy for many Black individuals is unattainable. It is unaffordable. It does not seem in reach. This also includes things like medications, if you have to pay co-pays, deductibles, premiums. Psychiatric care, that could be accessing an inpatient facility, right? If I'm unsure of the cost of bearing that weight.
We also know that discrimination erodes people's self-esteem. Because when you keep discriminating against me over and over and over, I may tend to even believe a little bit that maybe you are right. And that affects me and have this inferiority complex. When you have a healthcare system that discriminates against you, you don't trust that system. So when you need it, you don't want to go there. Why would I go to a place that I need help, but people to treat me so bad that I feel worse that I went in there? I went there, I'm anxious. I went there, I'm depressed. But the way somebody looked at you, the microaggression, the dismissiveness. When you've been telling somebody about how you feel, because you're a person of color, they are thinking something else. I think I'm in pain. No, you should be stronger. You don't need pain medication. I'm feeling this way. Oh, he might be on drugs. So when we see all this discrimination, it doesn't help us navigating these systems which should be helping us. Sometimes the truth is they work against us. We also see that with all this, the overcrowdedness, and then underfunded communities. There's no infrastructure, recreational spaces in our communities, where your kid, your teenager, can go out there and have some basketball hoops, play some soccer, and get some energy out. We don't have many of those. In our communities, we don't have a lot of green areas. Why? It's because of the systems that we are in. We have limited resources and services. We have to wait longer times to get services because there's less services and there's a lot of us. The socio-economic impact also have other environmental stresses that contribute to the mental health well-being of the Black community.
Okay, the next the next slide. We continue with the maze today. I'll be speaking primarily with the first bullet point you see there, misinterpretation of symptoms and misdiagnosis. So Black individuals primarily are disproportionately misdiagnosed with severe mental illness, primarily specifically schizophrenia, other than mood disorders. Why? While white individuals with similar symptoms are more likely to be diagnosed with depression or anxiety. The main things to be mindful of with regards to why this is currently happening are the three that fall under the initial bullet point. Implicit bias, cultural differences, and then lack of culturally informed clinicians. If I start at the lack of culturally informed clinicians, I'm not going to go into too much detail here because Stephen and I have later slides that break that down a little bit more and provide fuller context. But if we look at and start at implicit bias, let's describe for everyone what that means, just so we're holding the definition. Implicit bias speaks to unconscious attitudes that can also be stereotypes, assumptions that we make about a group, right? Whether that be justly made or not, right? But these are all of the attitudes, stereotypes, and assumptions we have about a group. Why this is important? Because, especially in mental health care as a whole, those implicit biases can affect the decisions that we make for that individual that we're serving. The way we engage in communication, the way we may refer or even attempt to make appropriate referrals with that individual in mind. The care that's provided and ultimately pursued or not pursued. This bias among mental health professionals leads to over-pathologizing normal emotional responses. So when we think about an individual person that comes to us and they share openly about how they're feeling, whether that's emotional or physical, primarily the second part of that is systematic institutions. Why would I trust these institutions that have showed me historically and in modern day that I am unwelcome and that I am not seen? Hypervigilance, always being in a state of alert, that can also look like panic. Constant fear of being judged or targeted, always worried about the spaces you enter. If there are people in those spaces that don't look like you. Increased levels of anxiety, depression, and anger.
And with all these, like we said in some of our earlier slides, these things lead to a chronic situation, with a prolonged exposure to all of what we've been talking about, right from childhood to your adulthood. You see this over and over and over again. And sometimes there are even the vicarious ones, where your father is telling you what happened to him, and your grandfather said, the same thing happened to me. And now you are bearing all this information. And then you see them happen to your friends, your loved ones, your family members. And then for some of us, then it happens to you. So you have all this long list of these things repeating itself to people in your community. And it happened to you. So now it becomes like, oh, that's the situation. It's what it is. That's how I'm going to experience for the rest of my life. And these prolonged issues that we experience, they go a long way, like I said earlier, to add to the weight of managing your mental health. Lack of opportunities is seen as part of all these things. When you are being overlooked, when your contribution is overlooked, If you work in a space, you work in a company for 40 years, 30 years, 20 years, 10 years, and every single time you feel like your contribution is being overlooked, all the microaggressions, all the discrimination, over time it builds up, and all this contributes to your mental health, and they don't help us in navigating these ways.
The next slide primarily will focus on strategies for navigating the maze. When we think of strategies, the expectation is that we don't assume that people have these strategies already established and ingrained, right? For the most part, individuals have to learn skills, and when we learn those skills, we can then implement them in our everyday practice. And so these are strategies we would like people to hold, primarily to support Black individuals for themselves and for Black individuals to be able to be supportive in their community. It's information for you to hold because dually we would be doing the work to link those supports to this population. So, no-brainer, understand your need. Easier said than done in most cases. The average person may be self-aware and may be able to kind of speak to what I need, like what support do I feel is helpful to me at this current point in time. It's hard if you're not self-aware. It's hard to recognize symptoms and stressors. Usually they could be disregarded, not intentionally in most cases, or ignored. I always use a rule of thumb, especially when I'm supporting individuals, is if they disrupt your daily functioning, if you're not able to manage them independently, if they're causing strain with regards to relationships, daily functioning, and ability to manage tasks, that's a huge indicator. But you have to understand first and foremost what you need. You don't need to know what's available to you, but understanding your need is key. In terms of understanding your insurance coverage, Stephen and I had a conversation about this prior to putting this presentation together. And I had said that, oh my God, I don't even understand my health insurance. And so what I mean by that is, think about how complex health insurance is in general for us all to navigate. If we are, for example, privately insured, most of us, right, within reason. And we sometimes don't read anything in terms of our benefits, what our premiums are. We might get that in the mail. I'm guilty of not actually really reading that through. It's important to understand your insurance coverage because it's important for you to do the work in terms of following up, right? So I need to know, does my insurance cover behavioral health care? Do I have access to care coordination services? Do I know what care coordination services are? Am I underinsured? Is there an option for me to add secondary insurance? And so this is really huge because for the most part, a lot of people do not take the time and sit and be mindful and clear with regards to what their insurance provides. And again, we're still lacking in a lot of areas. There's still huge co-payments that we pay, but for the most part, this is essential.
The one thing that we know or that can help us to navigate this maze, some of the strategies, like Kira said, is knowing yourself, right? All of us in this room, you may have wives, husbands, friends, fathers, mothers, but nobody knows you more than you. If you're 45 years old, for all those 45 years, every single second, the one person who has been with you is you. Nobody else. The time that you have some symptoms, some challenges, the one person who witnessed that is you. And so to build a team, you start from this point, that I know who I am. And so that should inform me about what I need. But this system is so complex that if you don't start from this basic step of knowing who you are, what you need, it will be hard to get the right services. So once you understand who you are and what you need, now you have to get the right people on your team. Remember, you are the CEO of your life. You can fire and hire people anytime you want. If you're a mental health clinician who's meeting your needs, You say, you know what? It's time to transition to somebody else. You have a psychiatrist, a psychologist, your PCP. If they don't meet your needs, have a conversation. Get somebody else. Even when they give you a diagnosis and you feel like, no, this is not me. I know myself. This doesn't sound like me. You have the right to get a second opinion. You have to build the right kind of people around you to support you. Build the right kind of support team from friends, family members, who you can go to. People that you can trust. There are those around us who are friends, family members, that you don't feel comfortable sharing with them because they might go and say something somewhere else. They cannot be in your team to help you manage your mental health. Get the people you trust, those you feel comfortable in, you feel confident in, who can help you deal with this. And then also do your research. It's very important. Or if you want a clinician, mental health person, you want a psychologist, somebody to manage your medications, do your research. Take time to read about them. We all have smartphones these days. Google their name, check them on LinkedIn, check everywhere you can to make sure you know more about them and you feel like based on the information you have, they can be the person to support you on your path to wellness. It's very important. Then also, as you know your unique needs, you work towards your unique solution, a unique plan. You can have a plan like anybody else. Because what might work for me might not work for you. So it's very important that you take these steps as we navigate this maze.
So in the next slide, we're still looking in terms of things that we're going to recommend, but this is the call. Oh, sorry, did we go back, Steve? Sorry. Okay, yes. Great, okay, so knowledge of resources. I want to first start by the misconception that the individual person should be aware of resources that exist. It's important to note that some individuals, most individuals, do not know what resources are available to them in the community. I can't tell you how many times, just as a quick personal example, many people told me they've never heard of the Department of Mental Health, right? So the state agency that exists in the state that they live in, no knowledge of it other than an inpatient stay and a social worker bringing that to their attention and them initiating an application and learning about our services that way, right? So that's important to have everyone hold. The expectation that people should just know what's right in front of them within their reach or in the midst of their community should not be expected. But the goal is to have some knowledge of what's available to you so that you know that I can access these resources when I need them, when I'm ready to utilize them. And also having an understanding of the numerous amounts that exist, right? Because like Stephen mentioned, if something doesn't work for me, it's a lot of trial and error usually with most things. Like finding a primary care doctor. Sometimes that's trial and error. You find a doctor, it's not a good fit, you have to go back out and try to find a doctor that's suitable in terms of what you're looking for. But having numerous options or understanding that this is not the only resource available to you is key. I also want to add that it is our expectation as providers to be knowledgeable of the resources that exist, right? So I need to do my due diligence and understanding for the communities that I support, primarily communities that look like me, that I know what exists so that I can properly inform, educate, and then refer.
The next thing that we need to do as we try to navigate this maze is for us to be proactive. You need to be proactive and not always be reactive. Because when you are a person who have some challenges, you don't know when things might happen that you might not be in control to be reactive. If you are somebody who supports somebody with mental health challenges, you should try yourself to be proactive. Because you don't know when they might have issues that you might not be available to provide the support they need. And so in doing this, you have to follow your treatment plan. Be consistent. That's one of the keys in doing things in life. Be successful. Being consistent. Follow your treatment plan. Take your medications. If you feel like your insurance isn't going to cover your meds for the next 3 months, it's monthly, use your smartphone. All the calendars that we have on our computers, set reminders for yourself. So you can always get this refilled. If it's possible to have alternate refills, you do all these little things that can help you have a better mental health. You have to plan for ongoing support. Who is your support system? Who can you reach out to in times of crisis? If you have a support system, it helps a lot. People who understand you, who can even tell you, Stephen, I'm looking at you. You are saying this. That's not Stephen I know. That's out of place for Stephen. What is wrong? We need that kind of support system. Because there are times that we might not know what is happening around us. And for those moments, you need a trusted person. You need a third partner. Somebody who cares about you. Who can say, hey, the way you are talking, what you are saying doesn't make sense to me. And be honest with you. What is happening? Did you sleep last night? No, I didn't sleep. Maybe that's where it's coming from. You take your medications? No, I did not. There's a problem. You need somebody who can help support you in these times. When you don't have resources, you need a support system that can contribute to getting to where you need to be. If you don't have a ride, among your friends, your colleagues, who can give you a ride when the time comes? When you are in a tough place and you shut off your doors, you don't want anybody to come into your room because you are in a situation where you don't want to hear anybody talk, hear anything, because you need that space. Who can respect that space for you? And can say, you know what, I know you are in there, I'm not going to bother you, but if you need help, I'm right outside the door. Do you need food? I got food for you. You need water? I got water for you. Those are so little things that we need to help us navigate this maze. If you don't have it, you might go through this maze alone, and it will be fun. And what happens is, as the maze stresses you out, as the maze makes you feel overwhelmed, it might complicate your situation. So you need a very strong team that can support you. If you can join a support group, join a support group. So you can be there and share. Sometimes just sharing alone can go a long way to relieve you of what you are experiencing. Somebody knowing what is going on in your life is very important. To be proactive, prepare for crisis situations. Like I said earlier, when you're in crisis, you might not be yourself to make all the decisions that you have to make. Have a plan in place. Share with somebody. Say, hey, when things goes west, you are the person you're going to call. When they call you, this is how I want things to be done. This is the pharmacy I get my medication from. This is my doctor's contact number. Have somebody who can be there when crisis comes. Have a plan in place. I remember some time ago, I was working with somebody who was going to travel out of the country. And I asked this person, what is your plan as you travel for these 3 weeks? He said, no, I'm fine, I'm good. I said, I know you are fine. Right now you are fine. But when you go out of this country, when I cannot be reached, how do I support you? How does the doctor support you? So now we have to sit down and have a safety plan. How he should go to his doctor and explain to the doctor that, hey, I'm traveling for 3 weeks. I know I have enough medication, but anything can happen. My flight can get delayed. Anything can happen in that country that I will have to stay another 2-3 weeks. Can you give me extra prescription for this period? So if it does happen, I am still safe. We have to sit down, have a plan. Who are your contacts in those countries and your contacts here? So when things happen, you can reach out to those people. So having a safety plan, a safe plan, crisis plan is very important. So that even when you don't feel like it's going to happen, it's good to have them in place. Somebody once told me that there was somebody who was climbing a tree, and the man told him, take a stick with you, there's a snake up on the tree. So when the snake tries to come towards you, you can hit the snake with a stick. And the guy said, I don't think I need it. Then a wise man like money told the guy, you don't lose anything by taking the stick with you. If you bring the stick with you up there and there is no snake, just throw the stick away. But if you go out there and there is a snake, now you have what you need to protect yourself. So there are times that you might feel like we don't need a crisis plan, but it is good to have it in place as you navigate this system. It's a good strategy, such that when a time comes and you need it, you can use it. If you don't need it, it's just somewhere and you got no problem. And I think doing this will help you to be proactive in managing this. The other thing that you need to do as you navigate the system is advocate for yourself. Again, I'm going back to you knowing you than anybody else. I can speak for you, but I can't tell how you feel. How you feel, there is no equipment in the world that can detect how you feel. Your level of pain, there is no machine in the world that can detect your level of pain. Unless you speak out, unless you say it, nobody will know. So one of the key things that you need to do as you navigate this complicated maze is to speak for yourself. Be your own advocate. I know sometimes it's hard, because for most of us in this field, we can advocate for other people, for our patients, for our clients, but when it comes to ourselves, we tend to shy away from that. But to navigate this system, you need to advocate for yourself. Ask questions. Seek clarifications. What is the need? Like I said earlier, if your doctor or your prescriber or your clinician or your counselor, you feel like they are not helping you, advocate for yourself. Tell them that, hey, you are saying A, B, C, and D. I like Y, Z, and V. If you don't speak up, they would not know. You have to know your right. Like Kira said, some of us don't know our insurance policies and what it covers. And for that reason, there will be services that you are due, that you can leverage your insurance to get those services. But because you don't know, you're not getting there. Sometimes you have to call and stay on the phone to say, I need this. And if you know the right information, you can insist on it. And when it gets hard, you say, can I speak to your supervisor, please? Or can I speak to somebody else who knows more than you? Because if you don't do this, you don't get the services that you need. When you know your right, then you can tell people that, hey, this is what I should be getting and I want to get it. So familiarize yourself with your patient's right in Massachusetts, in the Central Mass area. It's very important. You might know some of these rights from other states, but they may not be applicable here. So if you are living here, do your best, go the extra mile to educate yourself to know your right. And then persist in finding what is right for you, what rightly fits your need. It is very, very important. Look for mental health professionals, psychologists, psychiatrists, who you think understand your culture, who have some understanding. They might not even look like you, but they have the knowledge. They have that understanding of what needs to happen to support you. And all these are going to happen only if you advocate for yourself. If you don't, there are things, resources that you have access to, but you might not have them. They won't be given to you. You have to go and tell people that I need this, I deserve this, I know information says I should get it, and I need to be given this. And this is how we navigate this.
So the next slide is going to be specifically the call for change. It is going to, oh, my apologies. Oh, no, it's call for change. Sorry, guys. Glasses and I still can't see. So expand access to culturally competent mental health care. This kind of piggybacks off what Stephen just said with regards to, yes, it's important to have individuals in professions like psychology, social work, healthcare that look like the population they support. And we still have huge gains to go there. Stephen and I will share a slide that kind of paints a picture of how stark those numbers currently are. But if you aren't able to see a provider that looks like you, this is where cultural competency is very important. Let's define it. It's the ability to work effectively with people from different cultures that are not yours, right? It involves being aware of your own cultural background and how that shapes your individual perspective. Because when you have clear insight on that, you're able to frame and hold that in a specific way that it doesn't negatively interfere with the work you're doing for the person in front of you. This allows you to be more respectful and open to other cultures. Cultural competency in mental health specifically focuses on acknowledging and respecting the diverse beliefs and practices of different cultures. And by understanding that a culture that does not have to be your own shapes the experience of the individual person in front of you, this can help Black individuals become stronger and healthier because they see that they are valued. The next point is invest in community-based programs and training. We do have a lot of initiatives in the Commonwealth that are on the forefront of providing care and training to reflect the individuals that they support. We want to primarily develop support to this community, and we want to enhance Black male in mental health professions. So something as simple as initializing funds that can be used in terms of policy that now transcends to systematic equities, addressing that's what we want to be mindful of, and it's possible.
And to add to that, with the policy changes, some of this have to come from us, as a community, as advocates, as practitioners. We can ask for these reforms to address the systemic inequalities that are in our system. Some of the things that we can advocate for is even the collaboration between institutions, how we can bring mental health even to our communities. And I'm glad that Massachusetts have the CBHC programs where we are bringing mental health or behavioral health services to the communities. These are some of the things that we can all work towards to focus on the population that most needs this support. We can ask our senators, our legislators, make your voice heard, so that we can make policies that support this community.
Yep, we have a few more slides. We're getting there. So the call for change continues in terms of advocating for change in your community. I do want to provide a few examples just to provide context of what this could look like. Pushing for better funding for local schools. In Black communities, historically, schools in those areas have been underfunded. So one thing could be to push for better funding in local schools. Supporting initiatives to improve access to health care. Again, in the Commonwealth, we're doing a good job with regards to bridging those gaps. Raising awareness about social justice issues and promoting equality. And then supporting organizations driving innovation in mental health. To actively support and promote positive changes within your local area, you do have to be intent on what your overall goal is. It's mostly awareness of the issues. You have the ability to influence decision makers, and decision makers don't always have to be at the top, right? Decision makers are people who have influence to make a determination to bring something that currently doesn't exist, even in small ways. Mobilize people to take action, motivate people to take action, and address identified needs, ultimately aiming to improve the quality of life for residents. Although policy changes and community initiatives add to that, there's things that we can do independently by what we bear witness to on a daily basis and giving information face to face.
And some of the culture change that we think we can all do, whether you're a practitioner or someone receiving services from the system, or whatever role you play, is we have to engage in conversations that can dismantle the stigma. Sometimes it might feel uncomfortable, it might feel difficult, it might feel like you have to be vulnerable, you're putting your issues out there. But it is very necessary. It is very important that we have these conversations. We talk about this. And what's talking about this conversation, having this conversation, talking about mental health, what can happen is we can share resources in these spaces as well. I remember last year I was in Ghana and I was giving a talk on mental health in another organization. And I think it went well. So somebody in the crowd after the event came and said, hey, I think you should come talk in our organization. And I said, I'm sorry, I have to go back to the US in 2 weeks. He said, you wait, you hear from us tomorrow. And lo and behold, they called me the next day and said, we want you to have this conversation. We're going to make arrangements to make sure we can have this in 2 weeks. And they moved heaven and earth, did all the publicity, did everything to have this conversation. Why am I saying this? The time has come for us to make it a priority to have these conversations. It needs to happen. The more we talk about it, we can normalize it. The more we talk about it, we can increase our understandings. The more we talk about this, the better our community have this knowledge, and they said knowledge is power. So as a Black community, or as a provider, as somebody navigating the system, it is important that we keep encouraging ourselves to have this conversation when and wherever we can to increase our understanding about how to make this system work. There's a call to change. Unless we do this, we can't change the system. The change will start with that conversation that you are going to have in your circles, in your teams. That's how we begin this change.
The next 4 slides, we're going to focus on the vision for change, or the vision for the future. Sorry, the vision for change, and then what we can do in terms of making differences. So be mindful that we want to see a mental health system that understands and reflects our community needs. Very self-explanatory, this bullet point. And it's being mindful with all of the information that we've shared thus far, that when you hold historical factors, cultural factors, social economic factors that Black individuals experience, the mental health system has to be reflective of that community. We also want to be mindful that there's a future where every Black individual receives care that is compassionate, respectful, and culturally attuned. Again, we do have a slide where we'll go into more detail about cultural competence. I will share also an experience that I had with an individual that I support that brings into visual context why that's so essential. But again, self-explanatory. This is what's rooted in terms of things to shift.
And as we move into the future, one of the things that we should also be mindful is that to have this culturally competent care services, we need to also ensure that we are learning as providers, and we are recruiting more people from the BIPOC community to support the work that we do. Language is important. You might have people who need support in the system, and the language barrier can be a reason why they don't get the support or why they don't want to seek services. Because again, like I said previously, they don't want to come to a place and end up being worse than they came.
Opportunities for transformation. So the first bullet point is strategies for improving access and care quality, policy recommendations and advocacy efforts, and the role of education and awareness in changing perceptions. If we think in terms of, and I know we shared a lot of information that speaks to each point, advocacy efforts, it's not lost that there are a lot of resources that are available currently with regards to advocacy organizations that primarily focus on supporting BIPOC communities, Black individuals specifically. NAMI does a really good job on their resource page with allocating multiple areas in which you can access advocacy organizations that primarily support Black individuals. I'll name a few. The Black Mental Health Alliance, which works to increase awareness and access to mental health services for Black communities. The Loveland Foundation, which promotes mental health healing for Black women and girls specifically. A Black Emotional and Mental Health Collective, or BEAM, which provides training, grants, and movements to support Black and marginalized communities.
As we go through this, I also want to make sure I want to be respectful of your time, so we might rush through some of the remaining slides quickly, so that we can make sure we don't make you stay here longer than you deserve or get your lunch cold. One of the things that we need to do is we can work together to make sure that this maze is uncomplicated. That's something we cannot think about. How can I do my work to make sure this maze is not complicated? It's straightforward, it's simplified, and it's clear information. But just think about yourself. If you were to navigate these systems, your insurance, the care you need, and it's so straightforward that you don't have to wait longer, you don't have to keep thinking about it, you don't have to figure out how do I go through this. That's very helpful. It's transparent. That's what we all need. So we hope that as we move along and work together, the future will provide a maze which is not complicated.
Improving cultural competency, this is very important. I'm going to start by a quick story. So working as a case manager in DMH, I had the opportunity to meet with and work with a young woman. I no longer work with her now. But I knew prior to meeting her that she was an African-American young adult. And when I first went to our initial meeting and sat down, and we had communicated briefly, very quickly over the phone. A lot of my conversations were with her parents, who sought out services for her independently. When I sat down, she was quiet for quite some time, and I had to initiate that conversation and just ask, is everything okay? And she said, oh, Shakeerah, I have to say, you are the first person of color, that's exactly how she said it, the first person of color, a Black woman, an African-American woman that I've never worked with anyone who looks like me. And this was someone who was 22, has been in and out of hospitals throughout most of her life, entered into services as an adult after struggling for a lengthy period of time. But that was not lost on me. And she was elated, right, that I was assigned as her case manager. And so a lot of the rapport we built was easy, just based off of that commonality that was shared. I could see that she was more open and receptive, freely herself, and I could understand, even in terms of language and the way she communicated, because it was ingrained, right? But I think that's important to highlight prior to understanding cultural competency, and then the stats that will follow this slide, because they're quite jarring. So the lack of representation, I want to define it for everyone, among health professionals means that Black individuals may struggle to find therapists or prescribers, ultimately people who look like them. And that is a barrier, right, in terms of seeking services. Will they understand my unique cultural experiences and needs? Will they feel comfortable, right, and provide and be able to share my experience based off my racial background? And having the cultural competency is important in understanding the work that we can do, making real strides there.
And as we move for this future that we all hope could help, we are hoping that we can have cultural sensitivity, right? Where you have people who understand you and are also sensitive to your culture and your background. We are hoping that we can have access to culturally relevant resources, support systems, professionals who understand you and knows you. We are hoping that we can have a system where we can break the silence by sharing our stories, by sharing what is happening to us, sharing our experiences, the support that we are getting. We are hoping that we can have a future where education and awareness is key, and we are all contributing to that. We are hoping we have a future where we promote therapy and support, instead of we or the system promoting the prisons, the prison business. We are hoping for a future that we can all advocate. Advocate for ourselves and the system, our friends, our clients. We are hoping for a future that we can have a community and social support as people navigate this system. We hope for a future that we can encourage peer support. People who have gone through this, people who have seen this, we say, hey, I went through that, I had that experience, I want to bring my experience to help you be a better person, to help you on your way, on your journey to wellness. We are looking for a future where we have a workforce development who understands the Black community. A future where we have a workforce that has culturally sensitive and know what we experience and how we feel. We want a future where we can use information technology, AI, to help understand our situations and provide the right kind of services that we need.
And I think, Stephen, what we'll do in fairness of time is we can go just show the statistics with regards to, or I can actually, I'll quickly just read them. Yes, just so people have them. So based off of recent data from the American Medical Association, I just want to read 3 statistics for you just to reflect what it looks like in terms of Black individuals occupying these spaces. So out of 100,000 psychologists in the US, only 6,000 or 6% were Black or African American. Out of 28,000 psychiatrists in the US today, only 1,120 or 4% were Black or African American. And out of the estimated 700,000 social workers in the US, only 91,000 or 13% were Black or African American. And again, these just speak to the dire need that still exists with regards to enhancing all of the points Stephen raised. There are a lot of initiatives, won't go into detail right now, but there are a lot of initiatives that currently exist to engage those numbers because they're very low with regards to 48 million African Americans living in this country today.
And as we try to conclude on this presentation on how we navigate this maze, we want to ask that we all engage with local initiatives, support policies, reforms, and change the conversation. Sometimes you have to be part of the conversation to help navigate the system. And I tell you, all of you have experiences, have knowledge that you can share that can help somebody to make the right decisions. Sometimes you might feel like, oh, I don't have much to say. No. The things that you have gone through, that you have seen, you have read, you have heard on the news, they are all good informations that we can bring to the space, bring to the conversation to help other people. We need to be involved with community advocacy. You have to be. You can't be sidelined. Don't sit on the fence. Jump into action and help advocate for a community where we support mental health. We need to all help build bridges between mental health professionals and the community. It's very important. We can all join in doing that. And also, we need allyship. We need allyship. Even if you don't have any mental health challenges, you are the one that we need to be on our side, to advocate for us, walk side by side with us. When we need support, we know you are there. We need allyship, and each one of you can be an ally. Whether you are in the community or you are out of it, we want you to join this so we can all have a future where navigating this maze is simplified, not complicated, and people who start at one point can see the end of the maze. Don't have to think about the barriers and other things that work against our mental wellness.